ahead of these strikes, you expressed some concern about their impact. You said that they could pose a risk to patient safety. How has it been so far with one more day to go?
So I think the picture is that a combination of planning that NHS managers put into preparing for this week and the willingness of other members of staff, consultants, other medical staff to step into the shoes of junior doctors means that we have managed reasonably well in terms of urgent and emergency care. But the other side of the story is that in order to do that, we've had to cancel thousands of appointments and operations. So, for example, yesterday I was in a hospital on a surgical ward that was being basically staffed, along with obviously the nurses and other staff, but staffed by consultants. And they were coping well, morale was reasonable, but they were all aware of the fact that while they were on the ward filling in for roles that junior doctors would normally undertake, their lists of appointments, of operations was getting longer.
So are you reassured, though, that patient safety hasn't been compromised? Is that what hospitals are telling you?
I think broadly speaking, as I say, I think we've coped pretty well this week. But I think it's really important to say that when we talk about patient safety, yes, there's a kind of immediate issue. Are we able to see people in emergency departments, for example? And yes, I think we've been able to do that pretty well this week. But also there's an impact on patient safety when an outpatient appointment is cancelled or when an operation is delayed. And so certainly in those terms, those hundreds of thousands of cancelled operations and appointments will have had an impact on patient safety. And that's why as these strikes come to an end, and that is a relief to us, it's vitally important that we don't have further strikes and that the two sides in this dispute do get into negotiation, which is why it is we've been calling from the beginning of this week for ACAS, the conciliation service, to be invited to get involved and find a basis for the sides to talk.
Well, yes, and yet we heard from Chris Philp, the government minister, yesterday, as far as that was concerned, saying that the BMA had to call off the strikes first. We've also had calls from the Health Secretary that the BMA should drop its initial 35% demand before they bring in ACAS. Do you think that's fair enough?
I think I have the same sense that many members of the public I've spoken to and NHS leaders have, which is, why do we negotiate? We negotiate because neither side is willing to accept the starting point of the other side. And, of course, at the moment, neither side is willing to accept the starting point of the other side. But let's get into negotiation. And the sooner we do, the better. I think the BMA, to be fair, have indicated that 35% is their starting point, and they've also indicated they'd be willing to talk to ACAS. So I do think now it's up to the government to take that step to engage ACAS to find the basis for talks, because there is the threat of more strike days. And one message I heard very, very clearly this week, visiting a hospital yesterday, talking to hospital leaders all week, is that another set of strikes will mean that it becomes almost impossible for the health service to meet the really challenging targets that it's set for reducing the number of people, for example, on waiting lists.
Well, yes, and meanwhile, the nursing unions will announce the results of their ballots today. They've been putting the government's offer to their members. The Times is reporting today that the Royal College of Nursing, they say that it's likely that their members will have rejected the offer. How concerned are you about that?
Well, that obviously would be very disappointing news. And I would say that if that is the case, and it's speculation at this stage, but if that is the case, I would really encourage the trade unions and the government to immediately get into talks. Obviously, the gap is not huge. According to the Times, if the offer has been rejected, it's by a relatively small amount. So the gap isn't that big. So let's get straight back into talks. Let's see if we can find enough to get this over the line. What would really worry me would be if we saw further strikes from our nursing colleagues and we saw, as it were, people getting back into entrenched positions. because an NHS coping with junior doctors strikes and possibly the renewal of strikes by other staff, including nurses, well, that will make the situation extremely difficult.
And on a practical level, what do you think would happen if one nursing union accepted the offer and the other rejected it? Because there are two unions who are coming back with their ballot results today. Practically, what happens in that scenario?
Well, I think as the RCN is the largest union, if it is rejected, then it means that the unions will not have a mandate to reopen negotiations and see if they can get a better deal. And as I say, I think the important thing, if that is the case, is that what happens is the sides get together quickly and see what we can do to close the remaining gap, and not that, as it were, the sides withdraw to where they were before talks started a few weeks ago, and we get back into an entrenched position. I don't think, clearly, whilst I understand how nurses feel, but clearly a rejection is bad news and it is of concern. So we need to try to respond to this creatively so that we can avoid further industrial action.
OK, well, Matthew Taylor, as we say, we await the results of those ballots. It's not clear yet how nurses will have voted. But Matthew Taylor from the NHS Confederation, we appreciate your time this morning. Thanks so much.
Thank you.